Welcome back to the channel, folks. Today we're diving into a story that perfectly blends sci-fi, dark humor, and a surprising amount of pride in human resilience. Imagine being the very first human doctor in a state-of-the-art intergalactic hospital. That's the reality for Dr. Aris Thorne. He'd earned his posting through sheer brilliance and a healthy dose of stubbornness, ready to represent humanity on the grandest medical stage in the galaxy. He imagined sharing groundbreaking human insights, collaborating on cosmic cures. He did not, however, anticipate that his greatest challenge would be explaining basic human medicine without causing a diplomatic incident. His first week was a whirlwind of introductions to beings of all shapes and sizes. There was Gleep, a gelatinous neurologist whose thoughts literally glowed, and a crystalline surgeon named Xylar who could reshape their own limbs into precise surgical tools. The hospital itself was a marvel, a place where nanites repaired cellular damage from the inside out, and bioscanners could diagnose ailments just by analyzing a patient's energy field. Compared to this, Dr. Thorne's medical kit, with its scalpels, sutures, and syringes, felt almost archaic. The trouble started during his first joint consultation. An insectoid creature, a Vexian diplomat, had a blockage in one of its 6 circulatory conduits. Xylar, the crystal surgeon, suggested a sonic resonance treatment to gently dissolve the obstruction. Gleep, the gelatinous neurologist, proposed a low-frequency psionic wave to persuade the blockage to dislodge itself. Then all eyes, stalks, and multifaceted lenses turned to Dr. Thorne. He cleared his throat. Well, in a human, if we had a similarly blocked vessel, a common procedure would be surgery. We'd make an incision, access the vessel, physically remove the blockage, and then suture the opening. A heavy silence fell over the room. Gleep's glowing mind pulsed a confused shade of violet. Incision? Gleep's voice echoed telepathically in Thorne's mind. You mean, you would cut the patient's body open? Yes, Aris said, trying to sound confident. We open the body to fix what's broken inside. It's standard procedure. Xylar retracted one of their scalpel fingers in alarm. You deliberately breach the biological integrity of a patient, the risk of infection, of systemic shock. It's barbaric. Dr. Thorne tried to salvage the situation. We operate in a sterile environment, of course. We use antiseptics, gloves, masks. It's all very controlled. But the word barbaric hung in the air. The Vexian diplomat was eventually treated with sonic resonance, and the procedure was a complete success. Dr. Thorne began to feel a creeping sense of inadequacy. Was human medicine really that primitive? A few days later, a new case presented itself. A small furry creature from a low-gravity world had shattered a limb after a fall. The alien doctors were debating the best way to regenerate the bone structure using focused light therapy. What would you do, Dr. Thorne? Gleep asked, a hint of morbid curiosity in its tone. Thorne took a deep breath. For a complex fracture in a human, we'd perform an open reduction internal fixation. Translate, please. Xylar chimed in, their crystalline form shimmering with apprehension. We cut the patient open, Thorne began, seeing the other doctors flinch. Realign the broken bones manually and then we affix them in place using metal plates and screws. The room went dead silent again, but this time it was a horrified, stunned silence. You insert foreign objects? Gleep sputtered telepathically. You put metal inside a living being? For them to keep? Yes, Thorne said, his voice small. The bone heals around the hardware. Sometimes it stays in for life. It provides stability. Xylar looked as if they might shatter. The body's energy fields must be in chaos, the constant metallic interference. You don't regenerate the bone, you just bolt it together like a piece of broken furniture. It's effective, Thorne insisted, but his words felt hollow. The team opted for light therapy. Again, it worked flawlessly. Dr. Thorne started to be known as the Butcher, a nickname he heard whispered in the corridors. He was the savage from the backwater planet who wanted to cut everyone open and fill them with scrap metal. His reputation hit a new low during a diagnostic meeting. A patient was suffering from an unknown internal growth. The team was using advanced energy cartography to map the anomaly. Thorne, trying to be helpful, suggested, On Earth, our first step for something like this would be an X-ray or a CT scan. Gleep's mind flashed a bright, alarming red. X-ray? Is that not a form of ionizing radiation? Well, yes, Thorne admitted. A controlled dose. It allows us to see inside the body, to visualize the bones and tissues. You bombard the patient with radiation? For diagnosis? Xylar exclaimed. Radiation is a known cellular destroyer. We spend cycles developing shields to protect from it, and you use it as a diagnostic tool? You poison the patient just to look at them? Thorne was starting to sweat. It's a very low, targeted dose. The benefits of the diagnosis far outweigh the minimal risk. But he had lost them. The word radiation had sent a shockwave of terror through the room. It was like he'd suggested diagnosing a headache with a hammer. The final straw, the incident that almost got him sent back to Earth in disgrace, came during a discussion about preventative medicine. Gleep was explaining how they use psionic conditioning to teach immune systems to recognize and neutralize threats preemptively. It was elegant, clean, and completely non-invasive. Proudly, Dr. Thorne decided to share one of humanity's greatest medical triumphs. We have something similar, he announced. We call it vaccination. Fascinating, Gleep pulsed. And how does this vaccination work? Simple, Thorne said with a smile. We take the disease we want to prevent, we weaken or kill it, and then we inject it directly into the patient's body. If the room had been silent before, it was now a vacuum. Gleep turned a shade of gray Thorne had never seen. Xylar's crystalline form vibrated with such intensity he thought it might explode. Let me be certain I understand, Xylar said, their voice dangerously low. To prevent an illness, you deliberately infect the patient with that same illness? A weakened, non-threatening version, yes, Thorne clarified hastily. It teaches the immune system to build antibodies, to create a defense. It's a biological training exercise, Thorne clarified hastily. It teaches the immune system to build antibodies, to create a defense. It's a biological training exercise. You are insane. Gleep's thought voice was a flat, emotionless declaration. You are all violently, suicidally insane. That was it. Dr. Thorne was officially relegated to paperwork. He was a pariah. His ideas were seen not as medicine, but as a series of escalating medieval tortures. He spent his days cataloging alien fungi and filing reports. His dreams of intergalactic medical collaboration shattered. Then the Cathar arrived. The Cathar were a silicon-based species, tough as rock and twice as stubborn. A freighter had crash-landed, and the emergency room was flooded with injured crew members. Their crystalline bodies were shattered, and their internal energy conduits were failing. The hospital's advanced tech was struggling. Nanites couldn't bond with silicon. Light therapy refracted uselessly off their crystalline hides. Psionic persuasion. The Cathar didn't have a consciousness the way organic life did. They were more like complex, living computers. The alien doctors were panicking. Their elegant, gentle methods were useless against this raw physical trauma. The Cathar were dying. In the chaos, Xylar, their own form trembling, sought out Dr. Thorne in his lonely office. Thorne, we can't fix them. Our methods are too subtle. Their structure is too rigid. Thorne looked at the frantic energy readings on the main screen. He saw shattered limbs and failing systems. He didn't see an alien. He saw a compound fracture. He saw internal bleeding. He saw a patient in shock. He saw problems he knew how to solve. Get me my kit, Thorne said, a fire reigniting in his eyes. And clear an operating theater. We're going to need a sterile field. Gleep appeared, its gelatinous form quivering. What are you going to do? I'm going to do what humans do, Thorne declared, grabbing his case. I'm going to open them up, bolt them back together, and hope they're tough enough to survive it. In the operating theater, the alien staff watched in horrified awe. Thorne wasn't elegant. He was brutal. He used a diamond-tipped saw to cut through the silicon hide, the incision. He manually pieced shattered crystalline limbs back together. He took high-density tungsten alloys, the metal plates and screws, and literally bolted the Cathar's bodies back into place. He used a high-energy laser to cauterize leaking conduits. It wasn't medicine. It was emergency repair. It was violent, invasive, and horrifying, but it worked. One by one, the Cathar's vital signs stabilized. Their internal systems, held together by Thorne's crude but effective patchwork, began to reboot. When the first Cathar regained function and clanked its newly bolted limb, a wave of stunned realization washed over the alien doctors. Later, as Thorne was cleaning his tools, covered in silicon dust and conductive fluid, Gleep and Xylar approached him. "We do not understand your medicine, Dr. Thorne," Gleep projected softly. "It is violent. It is crude. It seems born from desperation." Thorne paused, looking at his own hands, hands that could hold a scalpel and a suture with equal care. "On Earth," he said quietly, "we didn't have nanites or psychic healing. We had infection, trauma, and cancer. Our planet was a battlefield, trying to kill us from the moment we were born. So we fought back. Medicine wasn't a gentle art for us. It was a war. We poisoned the patient with chemotherapy, betting the cancer dies first. We stop the heart, fix it, and pray it starts again. We use killer bacteria to kill other bacteria. We do what we have to do. It's not elegant, but we survive." Xylar looked at the recovering Cathar, then back at Thorne. "You don't practice medicine. You practice applied violence and controlled chaos." Thorne managed a tired smile. "Yeah, we call it being a doctor." From that day on, he was no longer the butcher. He was the chief of trauma and emergency intervention. Because sometimes, when gentle elegance fails, what you really need is a human doctor who isn't afraid to get their hands dirty and bolt you back together. What a fantastic story about perspective. It makes you appreciate the gritty, determined history of human medicine. Thank you so much for watching today. If you enjoyed this tale, please hit that like button, subscribe, and ring the bell so you don't miss our next dive into fascinating stories. We'll see you in the next one.